Well, good afternoon, everyone, and thank you all for joining us, and welcome to our Research and Evaluation Network webinar for April. The theme of the webinar today is data governance in the community services sector. This topic has generated a lot of interest with over 120 registrations for today's event. So thank you. If you are new to our network, welcome. And if you've joined us at a previous event, thank you for your continued support in these discussions. So today I'm going to give an introduction and a 15-minute overview around data governance. I'm then going to hand it over to our guest speaker for today's event, Luke Coffey from Queensland Positive People. Unfortunately, Cleo Gardiner sends her apologies for today's webinar. She's been held up with other business. So after Luke's presentation, there'll be some time for some Q&A. And I'm also going to do a quick wrap up with some key takeaway messages and highlight some events that we have coming up. So a couple of housekeeping things to note. By default, you will be on mute, but your camera will be turned on. This session will be recorded, so if you don't want your face shown in the recording, please feel free to turn your camera off. For today, if during Q&A you would like to ask a question, please write the question in the Q&A function. There is a chat pane too, but because there is a large number of people registered for today's event, using the Q&A will help us identify direct questions to us rather than general comments. The other option is you can put your hand up using the raise your hand emoji and then take yourself off mute to ask the question. So I'd like to begin by acknowledging the traditional owners and custodians of this land, the oldest continuing cultures in human history. I acknowledge the Yagara and Turrbal people of the lands on which I work here in Meanjin in Brisbane. I'd like to pay my respects to all First Nations colleagues joining us online today. QCOS thanks First Nations peoples for the gift of the Uluru Statement from the Heart. We look forward to supporting work leading to a successful referendum to enshrine a First Nations voice to Parliament in the Australian Constitution, followed by Makarrata and Treaty. QCOS welcomes the invitation to walk with First Nations people in a movement of the Australian people for a better future. For those online today, please feel free to join us in acknowledging country where you are today through the chat function as well. So my name is Amy Dellett. I'm the Data and Reporting Analyst in the Research and Policy team at QCOS. And a component of my role is to facilitate and coordinate these Research and Evaluation Network webinars. This webinar event really wraps up our data capacity strengthening activities from last year, which we tailored around 5 domains: data infrastructure, data impact, data capability, data access, and data governance. And those domains were selected and informed by the Swinburne University of Technology Building Data Capacity in the Not-for-Profit Sector Interim Report, as well as the ongoing work we conducted with the sector, including our data systems case studies and our data evidence and evaluation needs assessment surveys. So like I said, the focus of today's webinar is around data governance. So where do we start and how do we define the scope and provide some information on this topic in a short amount of time? So unfortunately, I have really had to limit the scope of today's session. So I'm not going to cover laws and regulations, including the GDPR, the APPs, Data Availability and Transparency Act, the DAT scheme, data breaches, freedom of information, consumer data right, information and management more broadly, including document and content management. I'm only briefly going to touch on Indigenous data governance and cybersecurity, and I'm not speaking about metadata standards and policies and procedures. Having said that, I am happy to share resources related to these topics. I think they're considerations that are really important aspects of data governance, and that they may all warrant their own webinars to explore some of these topics more in depth. So what I do hope to give you, though, is a point of reference on where and how to find more information and highlight some data governance resources and some key takeaways. We're also really keen to hear from other community organisations around how you're managing your organisation and client data. So feel free to share in the chat pane or in the Q&A session, or connect with us online in our forum to continue the conversation. So on my slide, I have an image which is from the Canadian resource called Data Governance and Management Toolkit for Self-Governing Indigenous governments. So I like this image because it highlights the interconnected layers and complexities of this conversation. So at the top of the mountain is data management processes, the output of data governance activities. So it includes all activities involved with managing data. The next layer is the data governance structure. It guides and provides oversight to the data management processes. And the next layer is information governance structures. So it guides and provides oversight to all information management processes, including data governance. And then finally, all activities rest on a foundation of communities and organisations' underlying vision, principles, and objectives. So I know I did just say that I'm not going to include information management in today's session, but I did really want to highlight that the types of data and information your organisation is collecting will determine the level of security that you need to apply to the information, in how it's handled and how you manage and store data at every stage of the data lifecycle. So on this slide, it lists details of an information classification scheme published by PricewaterhouseCoopers Australia. It's also referred to on the Info Exchange Digital Transformation Hub. So the information classification sits within a broader information security policy template, and the levels of classification are public, internal, confidential, and sensitive. So the Queensland Government has something similar, which is an information security classification framework, where agencies classify their information and information assets according to business impact and implement appropriate controls according to the classification. So business impact is assessed and analysed in terms of the impact to confidentiality, integrity, and availability. And then confidentiality labels are then applied to the information, which are official, sensitive, or protected. So that is a little taste of information security. So moving on to data governance and how we define it. The Building Data Capacity in the Not-for-Profit Sector Report defines data governance as laws and regulations, industry-specific guidelines, ethical principles, data sharing contracts, internal data protection policies and practice frameworks governing the collection, use, and disclosure of data. So established processes of leadership, stewardship, and accountability for the ethical generation and use of data for decision-making. So in the same report, it gives us some suggested prompts and practical ways to think about and reflect on data governance and how it relates to the organisations that we work within. So some of these prompts include who oversees the legal and ethical compliance of data use, what are the responsibilities data specialists have, what are the laws and regulations governing data use in the not-for-profit sector, how does your organisation deal with personal and sensitive data, and does your organisation have data sharing agreements with other partners? So what is the context of data governance in the community services sector? So most organisations have a sound understanding of the legal requirements regarding privacy, confidentiality, security, and de-identification in the treatment of personal data. Not-for-profit organisations need to manage risks associated with data breaches. However, there are many gaps in the policies and procedures around data security. And how do we take data strategies beyond legal compliance? So challenges exist with developing best practice data governance to address evolving concerns with ethics, consent, and potential data harms, especially as data begins to be underpinned by automated decision systems, and the increased use of personal data and automated systems raises ethical issues, including gaining community trust. And so we've actually got a session in May around automated decision making and the impact that it has on the community services sector. So it's all really relevant at the moment. And then there's also rules around client confidentiality and how that shapes how data is managed, stored, and used. So the latest Info Exchange Digital Technology in the Not-for-Profit Sector report released last year found 45% of not-for-profit surveyed are yet to develop a data breach response plan. 54% of organisations have a process in place to manage information security related risks. 35% of not-for-profits are yet to implement multi-factor authentication. and 49% of organisations have an information security policy in place. So when asked the question as a result of COVID-19, what aspects of your technology environment have you identified as a priority for improving your resilience in future crises? 45% of organisations identified building staff members' digital skills. So that was really identified as an enabler. And then 34% selected managing information and data privacy better, which is an increase from 26% in 2020. And then 34% said finding better ways of storing files and information. So I guess in the context of a series of data breaches, particularly in the last 2 years, data governance and cybersecurity really needs to be an important priority and component of how not-for-profit organisations operate sustainably now and into the future. And community trust and client opinions, perceptions, and public acceptance of how we generate and govern data inform community service delivery models and the capability of the sector more broadly. So now we have some context around data governance. How can we ensure best practice and good data governance to improve the perceptions of community and how we manage data as a sector? So a resource I wanted to highlight is the New South Wales Data Governance Toolkit. So the toolkit includes that when data governance is aligned to an organisation's need, it can deliver specific benefits across these 3 areas. So efficiency, business value, and risk mitigation. In the same toolkit is also includes some guiding principles of data governance, which you may want to include or adapt for your own organisations. And so the guiding principles are that data is business enabling, aligned to business needs and customer outcomes. Data is secure, valued and managed as an asset. Data is trustworthy, used and reused with confidence. And data is of high quality and where relevant, spatially enabled. Data is managed across the full life cycle, protected from unauthorised use and inappropriate deletion. And data is available and open to the community and government. And so I think points 5 and 6 here really highlight the tension that we all kind of sit here with around the use of data, which is on the one hand, we've got restricting and protecting its use and keeping it secure. And then on the other hand, it's making it available for use for decision making and transparency. So it's a really interesting space to be working in. And I do think that's why, all of us are here today to kind of work out how to do that safely. So the toolkit is also broken up into 12 modules. So including a data governance model in module 3. So the data governance model on the right-hand side of the screen is a practical model designed to assist New South Wales government agencies to develop or strengthen data governance maturity in their organisation. So the model brings together all the components that are vital for any data governance program, regardless of the agency. The model defines 4 interconnected tiers of data governance activities, each of which is critical to effective data governance in agencies. And so the 4 tiers are strategy and planning at the top there. So agencies clearly define the data governance program's values, vision and mission, and compose a business aligned strategy for governing and managing data as an organisational asset. Organisational structures and roles and responsibilities. So agencies ensure accountability for decision-making, authority for data-related activities, and are appropriately assigned and formalised at all levels of the organisation. And then the organisational enablers around agencies to ensure that the organisation environment is an enabler of good data governance. So this includes leadership, a data-driven culture, workforce capability and enabling technology. And then on a foundation of data management. So agencies ensure that their data governance program has oversight of core data management functions. So for example, data quality, data storage, security and business insights. So the model also really aligns with Gartner's golden triangle, which is of people, process and technology with data at the centre. So it recognises that effective data governance is an ongoing effort executed by people, enabled by repeatable processes and supported by technology. The next resource I really wanted to highlight today is around the 5 Safes framework. So it's an internationally recognised risk management framework widely adopted by the Australian Bureau of Statistics, the Australian Institute of Health and Welfare, or the AHW, and several other Australian government agencies, as well as national statistical organisations in the UK and New Zealand. So the 5 Safes framework is sometimes also called the VML security model, or in Australia, I've also seen it often referred to as the data sharing principles. So it was originally developed in 2003 as a way to describe a virtual microdata laboratory or a safe centre for confidential research data at the Office of National Statistics in the UK. And the concept behind the 5 Safes are, so each safe refers to an independent but related aspect of risk. It's flexible to respond to different types of data, such as personal data or environmental data, and different levels of risks as well. So it does take a multidimensional approach to managing risks, which is the 5 risk dimensions. So the framework can apply to all data when considering appropriate sharing and release, and it's often used for statistical disclosure control. So entities that want to share or release data would be required to manage the associated risks through applying appropriate disclosure risk management practices for each of the 5 Safes. So on the slide is an image of the data sharing principles outlined in the Sharing Data Safely report by the Office of the National Data Commissioner. And this is a great resource. It goes through each of the 5 Safes with practical case studies on how organisations are implementing and applying the 5 Safes in different elements of their work. So the 5 elements of the framework are safe projects, safe people, safe settings, safe data, and safe outputs. So for safe projects, it involves sharing data for appropriate and authorised purposes. So is the purpose of the use appropriate? For safe people, it's about sharing data with only authorised users. And, the questions you'd be asking is, can the users be trusted? The safe settings, it looks at using data in a safe and secure environment. So does the access environment prevent unauthorised use? In terms of safe data, it means applying appropriate protections to the data. So can the data disclose identity? And then there's safe outputs, which is really about ensuring public outputs from data sharing projects do not identify people or organisations in the data. And so other projects results likely to disclose identity. So the next 6 slides that I'm going to go through quite quickly are around referencing a different resource called Best Practice Guide to Applying Data Sharing Principles, and it's by the Department of Prime Minister and Cabinet. So this is a really detailed guide which actually has prompts to consider for each of the 5 safe domains, as well as before applying the data sharing principles and after applying the principles. So if you're not sure where to start or how to apply data governance within your work, this resource could really assist. It's all the questions I've included in these 6 slides are drawn from that guide. Because of time, I won't go through them in detail, but I have included them in the package. So when you receive a copy, you can go through it in your own time. But it's so each of the slides, so there's a detailed one around the safe projects, more detail around safe people, safe settings, safe data, and safe output. And also actually after as well. So any considerations after going through all of the 5 safes. The kind of thing that I wanted to just lastly focus on is around how the dimensions can actually be applied in practice. So they can be applied independently or assessed independently or considered jointly. So on the right-hand side of my slide is an image copied from the 5 Safes Designing Data Access for Research report. So it's used in a similar way to what's called a graphic equalizer, where each of the domain is assessed and graded as high, medium, and low risk, and then an overall level of risk is determined. So this is an example of where the 5 safes are considered jointly as all of the 5 safes together. The 5 safes can also be adopted for one specific project or for the organisation as a whole. So some other examples of the 5 safes application use. So the 5 safes can be used as a descriptor. So for example, when you're describing what your processes and protocols are, you could, your documentation, permissions, data classifications, and how you ensure your data governance is considered safe. So you can use the tool and go through each of the 5 safes and kind of just describe how you're managing data in a safe way. Another application is using the 5 safes as a design tool. So used to be provide like a framework for designing data access strategies. So at QCOS, we've used the 5 safes framework to guide components of our data sharing agreements with our community services and members to guide the data sharing demonstration project that's currently underway. 5 safes can also be used as a tool for evaluation purposes. So it could be applied retrospectively and kind of as like a review evaluation methodology, as well as in communication and training. So for example, there's the ABS Safe Researcher Training, which informs people who are undertaking the training of how they can use the 5 safes to ensure statistical disclosure control. And then 5 safes can also be applied in the wider data access context. So for example, ABS outlines this in their data confidentiality guide. And they kind of explain the way that ABS applies the 5 safes framework to 3 different levels of access to data. So whether that's open data on their website, or a basic level of access, or more detailed granular level access to microdata files. And then lastly, there's also potentially applications to qualitative data. So at present, qualitative data is used, it's largely managed by non-statistical approaches. And so they're kind of saying, so applying the 5 safes framework to qualitative data can help conceptualize and provide structure for decision making. And it's likely to be an area of significant development in the future as more unstructured and personal data becomes available for research. So in the chat, please feel free to share any other documents or resources that you have around data governance. And so the next component of our discussion today is to hear from community services on how they navigate data governance issues on the ground, and client consent, privacy and confidentiality, data sharing agreements, and governance of data projects. So QPP is one of the 3 organisations that myself and Scott had the opportunity to work closely with last year, writing up some case studies on how community service organisations collect, manage, store and analyse their data, and how they're incorporating and capturing consumer voice, engagement and participation into their service delivery models and data systems. So I thought I'd take this opportunity to really congratulate and acknowledge QPP on the work that they're doing around data governance. I know this work takes time and energy in addition to regular work. So really appreciate you, Luke, being here today. We have already heard from, in previous webinars, the 2 other organisations that were engaged with this work. So Communify Queensland and St Vincent de Paul Society Queensland. And they've both been guest speakers for our network last year and late in 2021. So I think it's a really wonderful opportunity to now highlight the work of QPP, and at the same time, share with you this report that we published in partnership with these organisations. So these are really in-depth case studies which will provide valuable knowledge and understanding for the sector around the use of data, including data governance. So it's available on our website, and I'll share the resource afterwards in our post email to the group. So I would like to now introduce our guest speaker for today, Luke Coffey. Luke is Rapid's Program Manager, a peer-led and community-based STI testing service operated by Queensland Positive People. So he has 6 years experience working in the sexual health program design, delivery, evaluation and research roles. So at the end of Luke's presentation, we'll have the Q&A time, and I'll hand it over to Luke. I'll just
Thank you so much, Amy.
Stop
I'll
sharing.
just share my screen now. Hopefully everyone can see that. Awesome. Hi, everyone. Thank you so much for having me. As Amy said, my name's Luke Coffey. I'm Rapid's Program Manager, and I'm here today to talk to you about data governance, management, and consumer engagement at Rapid. Before I get into my presentation, though, I just want to acknowledge that I'm on the lands of the Yagara and Turrbal people of Meanjin. I want to pay my respects to their elders, past, present, and emerging. And I also want to acknowledge any First Nations people that we have joining us here today. All right. I thought I'll just move on to the next slide. A good starting point to just give you a little bit more background context and an idea of what QPP does as an organisation is to maybe reflect on Australia's progress towards the UN AIDS targets. So these are targets about having a number of people diagnosed with HIV in Australia, then a number retained in care, a number on treatment, and a number with a suppressed viral load. So basically, we want to see 95% across all four of these sort of categories. And that's sort of the standard that the UN has sort of set and for us to work for. Towards rather. So I just want to highlight with this slide that in terms of the proportion of people living with HIV that are diagnosed, we're not quite meeting that target yet, and that's on the leftmost part of the screen. And then sort of the on treatment. The second graph on the right-hand side of the screen, you can see that we don't yet have 95% of people living with HIV diagnosed and retained in care on treatment. So there's a little bit of work to go, and that's basically what QPP is trying to address as an organisation. So our mission is to reduce the incidence of HIV and other STIs and improve the quality of life of those people living with HIV. We want our services to be inclusive, innovative, and equitable, and we really want to use this sort of rich lived experience of people living with HIV to inform service design and the way that we operate, because these people have first-hand experience of those factors that make people vulnerable to acquiring HIV. We offer a whole broad range of programs, and I'll go into more details in the next couple of slides. But our overarching mission is to help people live well with HIV. So one arm of our programs is the Life Plus program, and that is a peer navigation and treatment support program. So peer navigation is about people recently diagnosed with HIV, and it's to help them navigate that sort of the early weeks and months of that experience. So we'll talk to clients about disclosure, any stigma that they might experience in the healthcare sector, what legal advice that they do. There's migration work in terms of health waivers if people are trying to immigrate living with HIV, and there's also work that we do in terms of community campaigns and information and social groups and things like that. The treatment support arm of this program is case management. It's about helping people overcome barriers to treatment adherence that are experiencing quite often complex needs, mental health, addiction, domestic violence, housing insecurity, and it's working with them to address those factors to help them adhere to taking HIV treatment so they can sort of achieve the suppressed viral load. Moving on to my program, which is the Rapid program, and as Amy said, we're a peer-led community-based sexual health clinic. So we provision asymptomatic screening, that is that we won't see people with symptoms for STIs. We do immunochromatographic testing for HIV and syphilis, and I've got pictures of those test strips up there on the screen. But what we also do is molecular point-of-care testing for chlamydia and gonorrhea. So that's a nucleic acid amplification test. That's the same sort of test that's done in the laboratory for chlamydia and gonorrhea, but we do it at the point of care as well. So at our core, RAPID is a public health intervention, and we're seeking to do two things primarily. Address barriers to testing uptake, and we do this in terms of a lot of the design elements with how we run the program. We sort of operate after hours. We're centrally located. You don't need Medicare. We're free. You see a peer tester, not a clinician. So basically, it's this choice of any barriers that usually deter people from engaging in STI testing. We try to remove as many as possible to sort of facilitate testing uptake. We also have a health promotion component to the work that we do. So we'll educate clients on prevention measures, prophylaxis, how often they should get testing, transmission risks and things like that, with the aim of sort of improving sexual health literacy. So there's sort of a reduction in risk-taking behaviours, and then hopefully downstream of that, reduced transmission and reduced burden of HIV and other STIs. Now, we're not just a rogue bunch of testers doing whatever we want. We are overseen by an infectious diseases doctor that sort of makes decisions around what sort of test we use, and any sort of escalation of clinical governance issues goes to him for a decision. And we're overseen by several committees, both in the operation of RAPID, but we do a lot of sort of periphery research work as well, that we sort of have committees to oversee and make sure that we're adhering to everything. So I've already touched on the program objectives, but I guess on this slide, I just wanted to highlight who our target population is. So we're trying to target men who have sex with men, people from culturally and linguistically diverse backgrounds, First Nations people, young people, but that are over the age of 16, and people who are ineligible for Medicare, because these people are sort of vulnerable populations and experienced increased burden of HIV and STIs. So I'll skip over the rest of that slide because I've already touched on it. So just to give you an idea of our sort of the data that we do collect from clients and sort of better describe the clients that use our service, I've just got a couple of slides touching on the demographics of our clients. So you can see here that the majority of people that come into the service are aged between 18 to 24. That's from the left-hand side of the screen there. In terms of gender and sexuality, we see most people that identify as male, and then the majority of these are attracted to men. So I think it's about 39% of our clients are MSM. We also see significant proportions of straight identifying males and then straight identifying females. So we'll basically see any and everyone, but that's just to give you an idea of the sort of demographics of people that come through. Most of our clients are eligible for Medicare. That's at 78%, but we do see people who don't have a Medicare or that have overseas health insurance, and these populations face significant financial barriers to STI testing. And it's about 3% of our clients that identify as First Nations people, and we also see an even smaller proportion of people who are from non-Australian First Nations origins. What RAPID does particularly well, and this gives you an idea of the sort of sensitive data that we do collect on our clients, is we target high-risk individuals. So these are people with high numbers of sexual partners. So you can see the proportions of people on the left-hand side of the screen that have more than 5 sexual partners over a 6-month period. And then these people aren't consistently using condoms. So it's only about 12% of our clients that will consistently use condoms, which is obviously making them particularly vulnerable to acquiring STIs. In terms of the country of birth backgrounds of our clients, I've excluded Australian-born clients here just to keep the scale smaller. So most of our clients are from the UK, but you can see we see a whole bunch of different backgrounds and cultures looking at this sort of country of birth map here. So now I'll move on to sort of the data part of my presentation, and how do we collect all this data is a good sort of starting point for this discussion. So we use several bits of software. And I guess central to this entire process is best practice, which is a medical software that's often used in GP clinics. Importantly, it has the sort of appropriate encryptions and data protection requirements built into this software, because obviously it's used in medical practices and it needs to be compliant with things like the Privacy Act. So we'll use this to sort of create a unique client ID for each client's data, and we store all the identifiable parts of their data in this software, because it is very secure and it is also based within Australia. Some of our experiences in terms of trying to find software, there are issues if where the software is stored is overseas, because there are sort of terrorism acts and things like that that allow those governments to access your data if it's sort of stored within their jurisdiction. So that's something that we had to look at, and one of the reasons why we went with the best practice system. We also use Survey Manager to collect a lot of our demographic details, some of those that data I sort of presented to you before. It's a cloud-based survey platform. It's encrypted. It allows two-factor authentication, which is really important in terms of ensuring data security. And we basically collect all the registration data, but we use this as well for people to evaluate the service and collect any feedback that clients have. We also use Cepheid Gene Expert system. So that's the actual computer and machine setup, where we enter the best practice ID and then it will perform the test. And we use that best practice ID to sort of link the client's results back to the client's data back in best practice. And then we sort of collate these three systems using Microsoft Excel for reporting purposes. What we put into that Excel spreadsheet is the de-identified data as well. We only use the client ID, so there's no identifiable information like their names or addresses that goes into that reporting Excel. We store any sort of paperwork that we collect and this Excel file on SharePoint, and we also sort of have activated two-factor authentication to really limit people's access to all of this data. And then anything that we upload that we store on SharePoint, we encrypt and password protect, just to sort of ensure data security. One of the other software platforms that I use to analyze data and where I produce those sort of country of birth maps and things like that is this software program called Tableau. And I guess it's really helpful for data visualization purposes. And we can also do heat maps of clients' postcode data and stratify that by sort of infection and sort of do epidemiological analysis of the data there. And then just from a staff point of view, in terms of keeping the qualifications, blue cards, police checks, compliance, and sort of any HR reporting and analytics, we use Employment Hero for that. So that gives you an overview of what data systems that we use at the Rapid service. This is just a little bit of a map, and I've tried to map it to the client's experience and where how we collect the data. So at the sort of first part, so at the very top of this screen is the data collection process, and then at the bottom half of the screen is how it maps to the stage of the client's journey through getting tested. So when we first see a client, they'll fill out a paper-based registration form and a consent form, and that's getting consent to any of our follow-up procedures. It's consenting to sharing our data, but then there's also consent to be a participant in any clinical research trials that we sort of perform. So they're paper-based, and we encrypt those and store those to SharePoint and password protect them. So if any sort of there's any sort of breach of SharePoint, whoever's breached it won't be able to access this the paper-based forms, because hopefully they won't have the passwords there. We then give the client an iPad, and we'll collect sort of the demographic details, and then we store sort of all this Excel files on the Survey Manager database. And then we'll move across to creating the best practice ID. So we'll record all their details into the medical software. We'll map this to the iPad survey. So we've got, when we sort of download the Excel file that comes from Survey Manager, it will already be mapped to that best practice ID. We'll then add the best practice ID to the evaluation Survey Manager survey. We'll give that to the client. We have to fill out paper-based forms as well, done by Queensland Health, and this is sort of a surveillance form. That's sent back to Queensland Health, but importantly, that one we don't encrypt because we only use their name code. So the first two letters of their last name, the first two letters of their first name, and then their date of birth. And that's sort of standard practice for identifying clients in a de-identified way, communicating with some of the public health units across Queensland. And then, as I said, we sort of enter the best practice ID into the Gene Expert machine. It does the testing for chlamydia and gonorrhea. We record all test results back into the best practice ID, the best practice software. And then we use a reporting Excel, which sort of we just add the results of the HIV and syphilis test, and then I'll sort of export all the chlamydia and gonorrhea results, and then sort of compile it all into that reporting Excel. So hopefully that gives you an idea of how the client's experience maps back to sort of the data collection processes that we do. In terms of some of the data governance requirements, I've touched on some of those already in terms of like making sure data is de-identified, getting consent to share data and things like that. But we also have a rigorous auditing process. So I allocate 10 hours a week for staff to go through and audit data, check data, make sure that everything's entered correctly. And because we are sort of triangulating across several software systems, there's manual entry and there's sort of capacity for transcription errors and things like that. So we sort of really prioritize and have a proactive approach to sort of data auditing. I've touched on this before. We really sort of restrict access to data. So you can only access the RAPID data if you're working within the RAPID program. Best practice, the medical software can only be accessed physically from the clinic. There's no sort of offsite access or anything like that. We've activated two-factor authentication across all platforms that offer it. Sometimes that isn't always available. And then in terms of the Gene Expert results, that is only able to be accessed within the RAPID clinic, so there's no sort of remote access for that as well. And then that sort of computer system is completely disconnected from the internet, so there's no risk of someone hacking into it externally and getting access to those results. You'd have to physically break into the clinic here in Fortitude Valley. So we, in terms of oversight and compliance, we have all activity logs by whatever users in best practice. So we're able to track who's made what changes and who's opened what file. We have an advisory committee that oversees sort of the clinical workflows and the procedures and making sure that all the consent forms are fine, and that's done through a quarterly meeting. The Gene Expert Systems TGA approved. However, we have clinical trial data requirements, and we have sort of a constant review of making sure that we're meeting those requirements, because the sort of clinical trial infrastructure of or rather the expectations of what you have to have done, making sure your consent forms are signed. There's sort of a rigorous standard to be met there. I've already sort of told that, made mention that we de-identify data wherever possible, and where we can't de-identify that data, we make sure that it's password protected and encrypted. Most of that data that can't be de-identified is most of our paper-based forms, and then so this is using the Adobe PDF software to password protect and encrypt that data. In terms of consumer participation, this is something that's sort of, I guess, essential to sort of our sector. Within the HIV sector, we have sort of these GEPA principles, which is about the greater involvement of people living with HIV. I sort of touched on that earlier in terms of sort of benefiting from the lived experience of what makes people vulnerable to acquiring HIV and using that to inform service design, implementation, and evaluation. So this is something as an organisation that we stand by and sort of, I guess, live by as well. So our board is completely made up of people living with HIV. They oversee our governance, quality and risk and financial controls. So any sort of, it's a constant sort of, what am I trying to say here? In terms of getting consumer feedback, this board is made up of consumers, so it's a great resource for us as an organisation to really sort of have that informed voice of people living with HIV. With every rapid client that comes through the clinic, we get feedback from, it's not compulsory, but there's about 40% of our clients that will leave us feedback, and then we also make them aware of any sort of other feedback pathways, like in terms of being able to make a complaint and things like that. We disclose that to every client so they know if they do want to make a complaint, what that process is. And we really take a continuous quality improvement approach with any sort of feedback that we collect. The other thing that we've looked at doing in terms of increasing consumer participation with how we sort of operate as an organisation, we've created a community advisory committee. This is sort of to diversify the representation of people living with HIV in their ability to provide feedback to the organisation. So we'll consult this group on strategic priorities, our COVID-19 responses, any communication feedback and community development initiatives that we're trying to get across the line. What this has had, this is sort of, there was sort of some benefits and challenges to this, and I thought I'd share them here. So it required a little bit more orientation training and financial remuneration for CAG members, CAG being the Community Advisory Group. And this was a peer, and we tried to develop capacity in giving sort of the CAG members sort of support for secretary support and giving them a seat on the board to sort of develop that capacity in terms of meeting processes and things like that. Challenges, it required time. It required extensive engagement to get people and recruit people for the CAG. And we really needed to develop leadership pathways so this could sort of become a self-functioning group. Benefits of the CAG was it increased social connectedness amongst people living with HIV. It facilitated peer connection. It enabled these people sort of to develop, get sort of, I guess, across sort of meeting processes and board level processes and develop them professionally. So I'll move on. In terms of learned insights, in terms of our data collection processes, we had some challenges, especially around the data, because we have to collect quite a bit for our Queensland reporting requirements. So with best practice, there was maybe inaccurate defaults in the clinical software. So someone couldn't be both Australian and First Nations. It sort of reports those data fields as mutually exclusive, and we had feedback from clients that that's highly inappropriate. So we've really sort of considered collecting sort of ethnicity data from the client registration form and reporting from that, aside from using sort of these defaults from best practice. With our LGBTIQA plus clients, obviously there's fluid spectrums and individuals have certain preferences around what language that they like to sort of use to describe their gender and sexuality. So we've sort of consulted, we did sort of consultation to sort of get people's feedback on what is the most appropriate gender and sexuality terms. And we also give each client the ability to opt out of sort of describing their gender or their sexuality, or they can, there's an option for them to use their own terms if they're not sort of available as one of the pre-selected options. We've really struggled to collect accurate, culturally and linguistically diverse data because we're very conscious of data fatigue. It takes about anywhere from 10 minutes for a client to sort of start our data collection process and finish it. So the best way that we've been able to sort of address this is just use country of birth data as a proxy, with the disclaimer that this isn't going to be truly representative. You can be culturally and linguistically diverse and be Australian born. We just made the decision to not collect sort of any more data in that respect, because we really fatigue our clients with our data collection. We've looked at sort of developing valid survey questions. So we've constantly reflected on what we're asking our clients and whether or not we really need to get this data. Unfortunately, where we've made changes, it has sort of limited our ability to sort of compare past collections. Like, for example, we've only recently started collecting the condom and sexual partner data. So that hasn't previously been collected. So we're not able to go back and have a look at how or evaluate trends over time in that regard. And we've had I guess just a learning that it would have been really great to have sort of from the outset considered these things to allow for that sort of longitudinal data comparison. Another thing that we've sort of struggled with is data ownership. I've sort of mentioned that we have a lot of research programs. We collaborate with academic institutions, other community organizations, and we've sort of really struggled or had experiences where there was sort of issues around data ownership. So one of the learnings that we've had has been to sort of have these memorandums of understandings in place that really describe and define what people's responsibilities are with sort of data ownership, who does own the data. And that's something that I guess if you are looking at doing research work with external collaborators to really sort of consider and have everything tied up. So in terms of challenges, it's always a challenge to maintain data quality. A lot of our data involves humans, and unfortunately that comes with it human errors, transcription errors, things like that. We've tried to automate data collection as much as possible. We've also given clients the ability to sort of report their own data. That just ensures things like mobile phones, any identifying data is that they're more likely to get those things right and less likely to sort of make transcription errors, reporting that reporting that data to us. We also, because I'm quite skilled at Excel, we sort of don't have. I've looked at our sort of data systems and seen, okay, is this something that can be automatically collected, and then use sort of Excel programming to link data sets together, all in that reporting Excel, to really reduce the need for human involvement in our data collection processes. Unfortunately, because you need a significant degree of Excel literacy to do that, that sort of has created a bottleneck with sort of our data collection process, in that I'm the only one that's skilled enough to do it. I've tried to teach other people to do the Excel programming. There's a lack of interest, but then there's also a lack of sort of understanding all the code that's involved in that. So that's sort of something that we've identified as a significant challenge for the service going further. That then limits the amount of time that I can look at sort of analysing the data and doing some sort of systems level planning for where the service should go next, because some of my time is taken up with sort of just collating all the sort of the data that we collect. And then unfortunately, because there's no one data solution, we have to have several points of collection because we're sort of very unique in our needs, and we cannot afford sort of to pay for a software development company to create a custom a solution for us. But that's something that we're going to sort of look at and see if there's any other ways or opportunities that we can streamline the sort of data linking and system integration and sort of really reflect on those opportunities for improvement there. In terms of future opportunities, I really want to look at expanding our data visualization capacity. Tableau is really great for that in terms of the geographic data. I'd like to sort of do more deeper dives into stratifying the geographic data and seeing who is using our service. I really want to sort of enhance insights through data cross-tabulation, and then sort of use this to sort of support evidence-based service planning and health promotion. We also want to do more consumer engagement, and one initiative that we've put in place as an organisation is the biannual community engagement process to really sort of get more consultation and input from community in QPP's forward-looking strategic direction. And we want to broaden the CAG scope in service delivery, advocacy and health education. Awesome. Well, that's my presentation. So I'll hand back to you, Amy. Thank you so much.
Thank you so much, Luke. That was so comprehensive. I had all of these questions and you've actually answered them all. So yeah, no, that was really great. Just some reflections from me personally. I really enjoyed the data systems overview that you have with the client journey. And yeah, just the level of detail that you've just gone into the presentation around all of the challenges and enablers that you have managing client data, and that significant work involved with that, and really that incorporating the lived experience, through the feedback that you receive and the community advisory group and the board as well. So we also have some comments in the chat. I don't think there's actually any specific questions. So if anyone does have any questions, just send them through. We've got a couple of minutes to do Q&A. So the comments from Thea, they've said a great outline of documenting a very complex process and a big thumbs up. So yeah, they've also found trends over time difficult because, having to change questions and alter data criteria. I think, yeah, that's a challenge that kind of all of us face. And there's a comment here come through from Tara. So I'll just read that out. To contribute to community engagement, have you considered a data party to share your findings back to your program clients? Show them what you're doing with the surveys that they spend time filling out. That's a really good point. I've heard about data parties but haven't been involved with it, but it's about like presenting that information back to community. Did you have any comments on that, Luke?
I guess not to the sort of end users of the service, and that's actually, I mean, it seems like such an obvious thing to do, but it hadn't occurred to me before. So I think that's really great sort of feedback to take on board. In terms of communicating data, we do present a lot at national conferences, or we do a lot of published research and things like that. And I guess that's how we've really sort of looked at communicating sort of the data learnings that we do have. But I guess that would be interesting to sort of see if clients are sort of interested in, the data that we do collect as a service, and it's maybe something that I'm going to go away and have a big think about, because I think that's probably a really good point.
I think the amount of thought and level of input that you've put into all of the data governance structures that you have in place is quite impressive. So really want to congratulate you for all of the work, and QPP as well. I think so. There's other comments saying congratulations, and yep, that great presentation and thank you. So we do have time. I've just got a couple more slides, so I might share just going through some upcoming key takeaways and upcoming events. So if everyone wants to hang on for about 5 more minutes, that'd be really wonderful. I'll just going here. Okay, so yeah, really appreciate your time, Luke, yeah, just so good to hear, you know, like what you're doing on the ground in terms of data governance and how you apply the levels of security and data management to that sensitive information that your organisation is collecting. So thank you. So yeah, I will keep going with the key takeaways. So yeah, hopefully, Luke, oops, sorry, I have gone too far. My computer's catching up. There we go. So yeah, hopefully Luke and I have given you some ideas or new ways to think about data governance within your organisation. We have covered a lot of content today, so I thought I'd include some key takeaways around, so if you don't know where to start with data governance in your organisation, you could look at these kind of points in more detail around your organisation's processes or policies and procedures. So for example, do you have a data governance framework, or do you have a data asset register? Are you classifying, does your organisation classify your data into sensitivity levels? Do you have a data breach response policy? Do you have a data security policy? Perhaps you could start a data governance committee or something like a consumer feedback kind of governance type role. And can you get input from subject matter experts? Do you have a data quality policy in place, a data sharing policy, or a data sharing procedure? What are other data standards or frameworks specific to your sector? Have you thought about some guiding principles of data governance? Do you have a privacy policy in place, a data sharing request form, information management policy, information systems backup policy, internet policy, email use policy? Are you undertaking privacy impact assessments? So that's a lot of food for thought, and hopefully it will kind of prompt everyone to kind of learn more. And I would just like to acknowledge the Brisbane North PHN data governance team for sharing these insights as well with me. They are happy to be contacted for more information on these points. They do have a data governance framework in place, but it's currently under review and not public. So if you do want to reach out to the Brisbane North PHN, please get in contact with us. So then also just I've kind of included some summary slides, which is a lot of different links. So basically just a list of all of the resources that I talked through prior to Luke's presentation on this slide, so you don't have to go through the whole slide deck to find them again. On this slide, there's also some great examples of data governance frameworks and templates that are used within organisations. Then I've also got a slide on the Australian Research Data Commons, the ARDC. They have a wealth of resources on data governance and data interest groups that may be of interest. So they regularly share information and resources on data governance. So for example, the Australian Research Data Management Community, the Australian Sensitive Data Interest Group, and there's also a Data Management Plans Interest Group as well. On this slide, I've got some more resources listed from other institutions on data governance you can explore. And then I've also pulled together a slide on information around information governance. And so listed here on the slides, you can go through in your own time. And there's also a link to the latest statistics on data breaches, which is that second link there on the slide. As well as also on this slide, I've pulled together some resources around Indigenous data governance. So for example, the Luwicha Institute Pathways into Research Toolkit. So that was developed through an Aboriginal and Torres Strait Islander-led review and evaluation process. And the toolkit includes information on Aboriginal and Torres Strait Islander cultural and intellectual property, data storage and governance, community engagement, culturally safe research, leadership in research and ethics. And there's also many Aboriginal and Torres Strait Islander academics and researchers and leaders working in this field, such as Professor Maggie Walter, Professor Ray Lovett, Dr. Kalinda Griffiths and Sky Trudgett. So if you are interested in this topic on Indigenous data governance, I'd really encourage you to explore these resources further, and I've listed them on the slide too. So QCOS also has some resources from our wonderful Stacey, who coordinates our quality collaboration network. So she facilitated a really detailed 2.5-hour webinar, and that's recorded, around untangling privacy, consent and information security in the social services sector. There's also policy templates that have been developed by QCOS to assist organisations with implementing the Human Services Quality Framework around confidentiality agreements, client rights and responsibility statement, a privacy and confidentiality policy and procedure, and records and information management policy and procedure as well. There's also she's hosted 2 webinars recently on cybersecurity, and there's another webinar planned in May, and then 2 more later on in the year on cybersecurity as well. There's also a list of cybersecurity resources that, if cybersecurity is your jam, I've included that in the slide deck too. So you may be wondering what is next for the Research Evaluation Network this year, since we've now covered off all of the 5 data capacity domains. So last year, the authors of the interim report released the next iteration of the data capacity work, which is called a data capability framework for the not-for-profit sector. And it's a really easy read. It's only 12 pages long. I think it's a great resource for the sector, and it pulls together everything we focused on last year across the 5 domains. And then along with the responses from our end of year network survey, and pulling from this framework, there's really a lot of topics we can explore around collection methodologies and survey design, data classifications and standardization, data wrangling and data quality, ethics and research, and data inclusivity, data justice and data equity. So I have already shared the draft plan for the network in the last 2 webinars this year. So I won't spend much time here, but have included it in the slide deck so people can refer back to what our plan is for the rest of the year for the Research and Evaluation Network. Also, a friendly reminder that we do share all of the resources from the network on our Research and Evaluation Resources Hub community door page. And you can access the link, and we'll share those resources after the event as well. And then a quick reminder that there's an opportunity to connect with our network through our Research and Evaluation online forum on Microsoft Teams platform. So requests to join the forum can be submitted through the QCOS website through this link as well. And then our next webinar is on the 11th of May. And so that will be on ChatGPT and AI, implications of automated decision-making for the social services sector, with guest speaker, Professor Paul Henman from the ARC Centre for Excellence for Automated Decision-Making and Society. Finally, there's some of you may know about the Queensland Care Consortium funding to help and develop our sectors, strengthen our sector's workforce. So just wanted to let you know that the deadline for applications for this have now been extended to Tuesday, the 11th of April. So there's going to be some quick polls that if we can launch those polls. And thank you so much. I apologise for running a little bit over time today. Really work on getting that to the full hour next time. So thank you everyone so much for joining us. It's been really lovely. Thanks for, and have a really lovely long weekend as well. So if you can appreciate, if you can include and fill out our feedback form poll, that would be wonderful. And we'll close that off soon and then say goodbye. Bye. See you. Have a nice afternoon.